want to be back for the pigs we had to feed. How I wish that I could see Tata and Nana smiling at me in that old tin house by the sea. Tata's English was not so good.
Hafaday, and good afternoon. Thank you for joining us today for our press conference on the latest COVID-19 cases. I'd like to introduce the Honorable Lourdes Lou Leon Guerrero, Nagahagan Guahan, Governor of Guam. We also have with us Lieutenant Governor Josh Tenorio, Public Health Director Art San Agustin, Dr. Felix Cabrera, Chief Medical Officer for Public Health, as well as Acting Chief Public Health Officer Chima Mbakwan. I now like to give the Zoom floor to Governor Leon Guerrero.
Thank you very much, Crystal. Hafaday, I'd like to take this opportunity to give you some update on where we are now with our coronavirus situation on our island. We continue to have low scores, but we are seeing these low scores now increasing. Over the last 2 to 3 days, we went from a 0.3 CAR score to a 0.8, which is of concern to me. And this is one of the reasons for our press conference. We wanted to give you some update of where we're at, what's been happening with increases in cases, although slightly, but is important to surely monitor and to surely continue the surveillance and to be very diligent in our investigation, and of course, more so our protection to our people. So we have battled this longest public health emergency in recent history. We as a community overcame 2 surges and stay-at-home orders to contain the spread of this virus. But the strategy to eliminate COVID-19 requires constant, persistent vigilance. If at any point we let our guard down, we are risking getting back all the progress and being setting back all the progress we have made. And that's why I am here today to speak to you about our current situation. As I said earlier, we have noticed an increase in the number of confirmed COVID-19 cases, and this leading to multiple clusters. Since Sunday, we have reported 32 confirmed cases of COVID-19, 13 of which were from yesterday alone. And tonight, I am informed that the Joint Information Center will announce at least 9 additional cases. Just last month, we were averaging 4 cases a day. And as I have said, we have increased the cases, and we are now at a CAR score still low, but is for me cause to be concerned, because in just a few days, as I said, we went from 0.3 to 0.8. And here's what we know so far. Only 3 of those cases were identified through contact tracing, and none were from the quarantine. While some of the positive cases received their first dose of the vaccine, none of them were fully vaccinated. Through contact tracing, public health has identified 2 clusters, one from a karaoke bar and another at a social gathering at a private residence. Additional clusters are currently being investigated, and we believe the initial spread occurred during a game of basketball in a private residence. Contact tracing is ongoing, and we thank the individuals and businesses for cooperating with public health. It is important to note that these individuals took part in activities that are allowed under public health guidance. However, They, as many of us do, have let their guard down and put themselves at risk for COVID-19 transmission. We need to remember that a single case can quickly lead to a large cluster and to community spread. And these clusters and spread can quickly lead to more hospitalizations and will quickly overwhelm our hospital and will have a very negative impact on our ability to take care of our people, both with COVID and non-COVID cases. Our strategy, as it has always been and has worked, is to test, to trace, to track, and to treat. We continue to make tremendous progress in our path to half, but we cannot win this alone. We all know what to do, and we all know what works. Wear your mask, watch your distance, and wash your hands. These simple actions that we have committed to doing for over now 18 months is the best way that we can prevent even further spread of the virus as we continue to vaccinate every eligible person on our island. We are going to monitor continuously the situation, and we will not hesitate to change our course or shift our posture depending on any new developments. We have always stated that the new liberties that could go into effect after accomplishing our path to half was contingent upon COVID-19 transmission within our community. I must stress that we need to contain this cluster and control the spread in order for us to move forward in our recovery. I know that we are tired and that all of us want to go back to life before COVID-19. The quickest way to get there is by acting in ways that continue to stop the virus, which most especially includes getting fully vaccinated. I also want to emphasize here at this point and to note seriously that being vaccinated does not mean that you cannot be infected and you cannot be infectious. What it means is you can have the virus and you can give the virus to other people. And again, the importance of that is if we do allow opportunities to transmit this virus, we will go back to what we were before. And that means overwhelming our hospital. That means people seriously ill. And that means people can die as a result of this virus. So what we need to do to decrease the severity of the illness and to prevent deaths and admissions to the hospital, we must be vaccinated. I cannot overemphasize the importance of being vaccinated. That is the only way we can have herd immunity in our community, and that is the only way we can feel safe and protected to reopen our island again. Slowly but surely, by taking responsibility to ourselves and doing our duty to each other, we can come through this stronger than we ever were before. I want to emphasize that we continue to contain this virus. I want to emphasize that yes, our scores are still below 2.5, and our hospital admissions are now 4. And that's still pretty good, manageable. But I don't want, and what I don't want to happen is that our guards are down to the point where we again have a consequential surge in this virus. So I am urging you and I am pleading with you, please do not let your guards down. Wear your mask, social distance, wash your hands, and please get fully vaccinated. I have now here the Director of Public Health and of course, Dr. Felix Cabrera and Chima, who does a lot of the investigation and the contact tracing, to answer any of your questions, and I'll hand it over to Director Art San Augustine.
Thank you very much, Governor, Lieutenant Governor, and everyone with us this afternoon. So just a brief statement from our department. Today, along with the Governor and Lieutenant Governor, we are going to be providing data on the current conversation in our community over the concern of the number of positives we have seen recently as a result of our testing. The team with me today, as the Governor has introduced, is Dr. Cabrera, who is our Chief Medical Officer, and Chima Mbakwen, who is our Acting Chief Public Health Officer. In recent days, we have identified two primary clusters. Our investigators and contact tracers have identified the first cluster of April 3rd with origins from a basketball gathering at a personal residence. The events involved the basketball gathering, players from this game being a part of a Sunday gathering on Easter Sunday at a private residence, and then patronizing A-Class Lounge in Upper Tumon. These are all linked to the Easter Sunday gathering. The findings at this time are the persons that are testing positives are from our Filipino, Chamorro, and Chuukese community. The second cluster is from a party in Jigo on April 17, and this involves now a workplace of those who attended the event. The recent Subaki Hotel reports of positives. The positives and close contacts in this second cluster represent the Filipino, Chamorro, and Korean members of our community at this time. As we all know, this virus is non-discriminatory. It affects all ethnic groups and is therefore necessary. It is therefore necessary for us to do our part, to stay the course, to keep Guam moving forward towards herd immunity, a path to have. While we have all worked so hard and have been diligent in maintaining mitigating measures to stop the spread of the COVID-19 virus, these two clusters is an indication that as a community, we need to remind ourselves to remain vigilant as we are not out of the woods. The virus is here, has mutated in other places, and as previously reported, we have the California variant on Guam. Yes, we have a vaccine, and yes, there is traction to hit the 50% target for the possible reopening of Guam for tourism. We cannot rely on this effort alone. We cannot and should not take comfort in achieving 50% while the virus has not been fully contained. Today, we have two clusters, and it is our intent and the objective of the Department of Public Health and Social Services to keep an eye on the development of these two clusters, to continue to investigate and contact trace for additional contacts that we need to test, may result in quarantine or isolation, or the best result, negative. Therefore, effective tomorrow, Friday, and through Saturday, the Northern Regional Community Health Center will offer testing for those patrons and staff of A-Class Lounge and Subaki Hotel to be tested. I am encouraging the patrons and staff to know your status, to come in and get tested. Help us contain the spread of the virus. The test site will operate from 9 a.m. to 3 p.m. And we are also positioned to offer testing on Sunday should the demand be there. As we continue to enjoy the potential benefits of COVID-19 vaccinations, that includes but not limited to the prospects of reduced infection, hospitalization, and deaths in our community, all this will depend on our maintenance of the non-pharmaceutical intervention guidance by Department of Public Health and Social Services, keeping safe distance, washing of hands, and wearing a face covering. Relaxing our guard at this time will only increase our chances of enabling transmission to those who have not been vaccinated or fully vaccinated. We continue to enjoin you to please continue to wear your mask, keep physical distancing, and continue to wash your hands. And I also join the governor in her call to action to come out and be vaccinated and work towards being fully vaccinated, get your first and second dose, And let's work towards herd immunity for Guam and achieve Path to Health. At this time, Dr. Cabrera will provide medical perspectives with data on how we are transitioning as a community, and he will be followed by Chima Imbakwan, who is our acting Chief Public Health Officer, and he'll provide further details on the 2 ongoing cluster investigations. Thank you, Governor and Lieutenant Governor, for your support.
Good afternoon. I'm going to give a cluster report for April 2021 as the governor and the director just presented to you. The first cluster was a basketball gathering on the 3rd of April. 12 people attended this basketball gathering. It was held in a private residence. 8 out of the 12 tested positive for COVID-19. 1 person was symptomatic during this event, as reported to our case investigators. 4 contacts were also identified. They were tested, they were negative, but they are currently quarantined. On the 4th of April, 3 of the 8 positive cases from the basketball game attended an Easter Sunday gathering at a residence in Jigo. Out of this 25, Public Health was able to identify 14 close contacts. They were tested, they were negative, and they are in quarantine. We identified 1 community contact that is identified as a low risk, but Public Health is still monitoring this individual. We've been unable to reach 7 of the contacts that were given to us. We do not have, we have either wrong phone numbers or they've not been answering their phone numbers. So we are urging these 7 people to please, if you know you're part of this group of people on the at the Sunday gathering, please, Public Health is availing you to come and be tested so that we continue to keep the community safe. The 3rd cluster was at the A-Class Lounge. Currently, we have 28 people identified who visited the bar within this period. As of today, we have 14 positives linked to this 18. We also have 15 community contacts that have been tested and they are negative, and they are currently quarantined by Public Health. We are still monitoring the situation because a lot of people, we have 2 individuals who were not part of the establishment log sheet that was given to Public Health as required by Public Health for establishments and for record of people who visited establishments. We have two individuals come to the Public Health outreach in Tizan to get tested. So if you know you are also exposed at the A-Class Lounge, we also avail you to come to Public Health Friday and Saturday to get tested. And the next cluster is the Subaki Hotel cluster. We currently have 5 individuals who tested positive, and Public Health investigation actually traced it to a private party at a residence on the 19th of April. 3 individuals at the party tested positive, and all these individuals are staff of Subaki. And then the other 2 were also tested, or another 2 got tested from the Subaki Hotel when they heard about the individual who tested positive, and 2 of them turned positive. So currently, we have 5 positive cases from this exposure. And then for that private party, we've identified 18 individuals who are potentially exposed at that party. At the workplace, we identified 84 individuals who are also potentially exposed to the 5 Subaki positive cases. And then working with the hotel, we obtained a list of guests that came for dinner and lunch during this period this is between April 14th and April 18th. We've been able to identify 961 individuals who visited the hotel at this point. And we are also tagging them as potentially exposed, and we're also we're also asking them to avail themselves to public health testing Friday and Saturday. Thank you very much.
Good afternoon. I'm going to go ahead and share my screen, and we'll give some general updates on COVID overall in terms of data. So this is our standard Guam COVID-19 metrics as of 8 a.m. this morning. So as we know, our CAR score is at 0.8 right now. And then just going over to the test positivity rate, we're at 1.7. Our retransmission value, we're at 1.4 at this time. And then our daily new cases are at 6.6, and these are on 7-day rolling averages. So overall, we have 7,897 total cases. 61 of them are in active isolation. There have been 136 deaths, 4 active hospitalized, and I think I'll get into the hospitalization a little bit more later. Daily tests on 7-day average is 390. Our case doubling days is 1,091. So over the past 28 days, we've had 109 total cases. 68 of them are considered community cases, and 41 of them are travel related and were tested positive while in the QFAC. So that makes about 37.6% of our cases coming from the QFAC. Overall, in terms of vaccinations, between Gov Guam and private entities, there's 116,107 number of vaccines given. That's approximately 87.8% of our stock. And so first shot, we have the Gov Guam and private being 66,816, and Department of Defense about just under 7,000 at 6,955. That makes on Guam in total 58.7% of the adult population being 16 and over having gotten their first vaccine. And then for those who are fully vaccinated for Gov Guam / private is 49,291, and Department of Defense 7,852. So that overall means that we are 45.5% of the adult population, and so that's where we are in terms of getting to 50%. And right now, daily vaccinations given is about 1,567.4, not counting Department of Defense's vaccines. Now, this is our where we've been since the beginning of the first wave in August in terms of our hospitalizations. The hospitalization uses this left axis here for the numbers, and then our CAR score, and the 14-day death summary uses the right axis here. And as you can see, we've done a tremendous job of this numbers coming down. But if I were to zoom in more closely, especially since after PCOR 3 was declared, our hospitalizations continue to trend downward. We reached 0 admissions on a few days total, but then more recently we've seen it gone up, and so now we're at 4 today. And of these 4 that are hospitalized, 1 of them is from these cluster cases. And it's worth noting that the age range of those who have been identified in these clusters are anywhere between 21 years old and 44 years old. So overall, per data as of yesterday, actually, when we break it down, and if you look at ethnicities of new cases since the beginning of the year to April 21st, you can see here the total numbers, and I won't read out each number here, but you can see and it's arranged by the highest being the top being other / unspecified, then Chamorro, white, Filipino, Chuukese, Black or African American, mixed, and other Asian. And you can see how it breaks down in terms of community cases versus travel related cases. And you can see the differences in that, where the ones that have more travel than community cases are classified under white, and the Black or African American, and also the mixed category. So the breakdown of, again, travel related cases is just above 1/3 since the beginning of the year. So of these travel-related cases, where did they come from? So 165 came stateside, and 23 came from the Philippines, and 6 are from other destinations. And then last slide here, in terms of vaccine status and those who have tested positive after getting the vaccine. So those who have gotten at least their first dose, or only their first dose, there have been 21 confirmed cases since the beginning of the year. But of all those that have gotten their first dose, that makes up only 0.028% of those who have gotten their first dose only. Now, of the second dose, but still less than 14 days after their second dose, which means you're considered fully vaccinated 14 days after your second dose. There have been 14 that have been identified. That makes up at 0.025%. And those who have been fully vaccinated, so this is the true breakthrough of those who have been considered fully vaccinated, but still had a confirmed positive in terms of their test. So that makes up 0.012%. So this is extremely low, very low penetration. So I want to take this opportunity to really point out the difference you can see here of being fully vaccinated and your odds of testing positive when you're fully vaccinated. It still exists. It's not zero, but it's extremely low. But then also you improve your chances by getting your second dose. So there's a lot of people who still have not gotten their second dose. And even if you feel like you're very overdue, even past 42 days, still come out and get it. The CDC still says that it's okay to get it. You don't have to repeat the series. But you can cut your chances in half even just after getting the second dose. And that's the end of my slides. Thank you.
Thank you. I'd now like to open the floor to questions from members of our media. From the Marianas Business Journal, Maureen Maritita.
Thank you, Crystal. Good afternoon, everybody. I have a question for our governor. Governor, Dr. Cabrera said referred to the reopening of tourism as, I believe, possible. Could you comment? Because I know you know that May 1 is just around the corner, and we have a lot of businesses that are supporting the reopening and reopening themselves, even though we don't expect a rush of tourists on May 1.
Sorry. Yes, Maureen, thanks. We are still in the path of reopening, and we are still in the path of relooking at our travel protocol restrictions. The reason, Maureen, that I had asked to do this press conference is, as you are aware, we are continuously monitoring our situation here with coronavirus 19. When I start seeing things that concerns me, I want to alert it out to the public so that the public is aware, and so that they can again begin to be a lot stringent on their wearing of the mask, washing their hands, complying to the mitigation efforts. We are still on our path to half. I have said that the May 1st opening is contingent on our achievement of that goal, and as long as the conditions continue to measure that we are still containing this virus. I want to again say that our virus and our efforts to contain this virus continue to work. But when I start seeing things that is getting to be a little concerning for me, I want to alert our public so that they are aware that there are some slight increases to these positive cases. And as you heard Chima, these are coming from social gatherings. They're coming from, parties. They've come from the bars, one bar, as far as we know so far, but we continue to investigate it. So I want people to know what is going on so they can regroup again and adhere to the protocols, adhere to the preventive mitigation efforts so we can continue to contain and maintain this. I am hopeful and confident that we are, and I'm very hopeful and confident that these numbers will continue to go down again. But it would be irresponsible of me not to let the public know about what we are seeing, and we want to work with the public to prevent it from any more increases.
Okay, so you're not asking people not to gather. You're really saying that
We're keeping our guidance. We're keeping what we have done. I'm just asking people to not let their guards down. I was in situations and parties where people aren't wearing their mask, and they would say to me, "Governor, but I've been vaccinated." That's a false sense of security. I just want to make that very clear to our people. Because you're vaccinated doesn't mean you won't get the virus, and it doesn't mean you won't infect your loved ones, your neighbors, your friends, your family. So wear your mask, social distance, and wash your hands.
all right. And I have a question for the Lieutenant Governor, if I may. Are we going ahead with the beautification plans for Saturday?
Yes,
The
Maureen,
island cleanup?
yes, our cleanup will go on again. If you are sick, stay home, do not attend. If you were exposed to or were present at any of the events that were described by public health, do not attend. Do us a favor, but come. You can still register. You could, if you want to just stay in your home, clean up around your home, but go to Guam Visitors Bureau to their website if you want to sign up. Bring your mask. Please observe all of the safety precautions, and let's have a great event on Saturday. Thank you.
Okay, thank you too.
Thank you, Maureen. We'll come back to you for another
Thank
round.
you. Thanks.
PNC, Jerry Partito.
Yes, my question is, what led you guys to that to those clusters? How were the initial positive cases identified? Were they in quarantine, or were they identified during the routine testing? What happened exactly?
To answer your question, what happened is that if there is any positive case that is reported to public health, a case investigator is assigned to that case. And the reason is to interview the individual to find out circumstances surrounding them so that we can identify if other people were involved or were present at the time the person was infectious. So that is the primary role public health plays when we have infectious diseases reported to us. So with that, we now start following up all the individuals who were identified by the person who tested positive. So if you look at the way public health followed up the case, it started at the basketball. And then as we go on interviewing individuals who test positive, we identify people who are their close contacts. We quarantine them. And during the period of quarantine, if they develop symptoms, we test them. Or if we can also ask them to go get tested depending on how the information that we obtain from the individual who tested positive. So it's an ongoing process and it's part of public health protocols for any infectious disease. This is not limited to COVID alone, but all other infectious diseases.
No, you said it started with the basketball cluster, right? So what led you guys to that basketball cluster? There must have been an initial positive case that led you to contact tracing, that led you to that basketball cluster. What was it? Was it during quarantine, or was it through regular COVID testing in the testing centers?
If you're symptomatic and you go to the clinic to get tested and you're positive, then we start your case investigation. So for this particular cluster, one person was symptomatic during the event and went and got tested and was positive. And then through case investigation, we were able to identify all the other cases.
No, but what led you to that particular case, to that cluster?
So Jerry, can I just inject in here? This is the consequences of contact tracing. Initially, I said you test and then you contact trace. So the person that was playing basketball at this basketball event apparently was symptomatic, went and got tested, became positive. So as a result of that, it was investigated and then the cluster was found. So the index case of this basketball event was a person that was playing basketball at this event, got sick, went tested, positive. That's the source. The source was the individual themselves or himself or herself that went and got tested. And because they're positive, all positives get investigated. And from that investigation, based on what they find, they'll test them and so forth. So the source is the individual themselves.
Okay, I got it. Thank you.
Thank you, Jerry. KUAM's Nestor Lacanto.
Thank you, Crystal. I just want to go, if Chimuge, could you just real quickly go back over the chronology of this? These are three separate clusters, right? That started, for the first one was the basketball game, and then that group went to A-class lounge?
What happened was at the basketball game, there were 8 people, there were 12 of them. Out of the 12, 8 tested positive. Three individuals out of that initial basketball game attended an Easter gathering. And then someone also from the basketball cluster visited the A-class lounge. So that is the connection of the cases.
Okay. And then there's a separate gathering on April 17th in Jigo.
Yes.
Where there were about 25 people.
Yes.
Okay. And then how many were tested positive from that particular gathering?
So if you look at the numbers I presented, we identified 25 people. Out of this 25, 3 of them were already exposed at the basketball game. So they are the ones that had the virus. Then out of that, if you minus that 3 from 25, we have 21 individuals.
Right.
Out of the 21, 14 of them who were also identified as close contacts were tested and they were negative and they're in quarantine.
Oh, okay, I got it. So that was also linked to the basketball game. All right, and then Subaki Tower, that's separate?
That's another cluster.
Okay, so it's a separate cluster, okay. And then-
yeah, but we're still investigating.
Sorry?
Yeah, no. So we're still investigating the Subaki case because it started at a private residence.
Okay, and employees of Subaki, or they were patrons?
employees were at the private residence for the party.
Okay. And then you said 84 hotel employees were exposed, and then net
So we're at-
961 patrons?
Yes.
Okay. And the
So-
and the 960 and the 961 you were able, sorry, Governor, go ahead. I'm sorry.
I just want to interject that from April 14th through April 18th, these are the patrons that are being asked to get tested from Subaki. So if you, Nestor, was at Subaki eating between April 14th and April 18th, we suggest you go get tested.
Okay. Yeah, and that totals 961. Did the hotel follow that the protocol where people are supposed to sign in and all that stuff so that you can trace them back?
That was how we got the 961
Okay.
individuals.
Okay.
But to get it more efficient, just that if you have been at a Subaki during that period of time, just come out and get tested. Don't wait for us to call you.
Okay, thank you. I'll
We are
defer
going to be
and
calling.
go to the second round.
Thank you, Nestor. We'll come back again for another round. Marvick, Pacific Island Times.
Hello? Can you hear me?
Yes,
Hello?
Marvick, we can hear you clearly.
Okay,
Go ahead
sorry,
and ask your
sorry.
question.
I'm sorry. Governor, given the emergence of these two new clusters, are you considering the temporary reinstatement of some restrictions that have been eased, such as the restaurant and bar capacity limit?
No, I'm not.
I have a question for you. The health profiles of the 7 fully vaccinated people who tested positive, what set them apart from other people?
Can you repeat that? Marvick, you were cut off in the beginning.
I'm sorry. This is for Dr. Cabrera. Fully vaccinated people who tested positive. Do you have their health profiles? What set them apart from other people? Do they have a certain medical conditions or what?
I haven't been able to review these very specific cases yet at this time, but it's something that we will be looking into because there are breakthrough cases.
But I think it again emphasizes the point, Marvick, that even if you're fully vaccinated, you could still get infected.
Okay, can I have one more question regarding the Subaki? I understand that they closed 2 of their restaurants, but their hotel rooms continue to remain open. Are they going to be required to suspend operation? Subaki is a very popular staycation hotel, and it's for locals. So there is a possibility that more people will be get exposed. Will they be required to suspend?
In answer to your question, Public Health actually did a walkthrough at the hotel yesterday. Part of the case investigation is to actually identify where the disease transmission took place. And what we realized was that after our case investigation and interviews with the hotel, the place that we identified was the restaurant. So the front office staff was not involved in this particular exposure. So the closure of the restaurant is in line because that was where the individuals who were exposed and who got positive work. And part of the extensive investigation we conducted yesterday, we did a walkthrough of the hotel to check the workflow of the staff. We went through their intake process for staff, looked at the staff dining area. We also checked out their shower room. We also made sure that they had infection control protocols in place in the restaurant. And notwithstanding that all these things were up to standard, public health went ahead to tell the hotel to go ahead and test all the staff who work at the restaurant. And we also offered them a testing opportunity for all the hotel staff on Monday. But right now, the only place that the disease we actually identified as the area that the transmission occurred was the restaurant, and it's closed right now.
Thank you. I have no more question.
Thank you, Marvick. Heidi Gilbert, the Guam Daily Post.
Good afternoon, Governor. Given what you and your cabinet presented today, will you still allow the track and field meet to proceed this afternoon?
Nothing changes. Everything remains the course. Because we're still at a point of containing the virus. So nothing changes. Everything remains the same. Events that are scheduled can continue on.
Even if they exceed the public health limitations, like the number of the spectators and the number of participants?
No, they cannot exceed. They have to be within the guidelines. That's why I'm asking everybody to please comply to the guidelines and the mitigation efforts so we don't have a consequence of increase and a surge.
Okay, my second question, has public health or Guam resumed the use of Johnson & Johnson vaccines? Because right after it was paused, there were only 306 doses of Johnson & Johnson reported to have been used. But I think last night we saw it increase to 406.
To your question, yes, it is 406. I also had inquired about that because when we initially issued the pause, it was at 306. And what had happened there was late data entry on it, nothing more. It was just a late data entry. Those vaccines were administered before the order to pause was issued. And so at this point, we do have Johnson & Johnson. We have the J3 vaccine, but we are not using it. We are still waiting for further guidance from CDC. So that was the change from 306 to 406. Thank you.
So Director, have you received the 8,000, I believe it's more than 8,000 doses that you ordered in additional doses?
We had a balance on J3 and we did receive 8,500. We have a balance available for April to be ordered at 8,400, but we are pausing at this time because we are wanting to first receive the CDC guidance. There's a recent survey that we were asked to do because of that situation, and we've also made a request for more Moderna and Pfizer because of the J3 situation or the Johnson & Johnson vaccine. So you're right, I think we pressed that out, right, Crystal? 8,500, we're still balanced of 8,400. Then this is vaccines for the month of April, but we are waiting for CDC guidance before we move on with the use of J3. At this time, it's still in vaccine storage. Thank you.
Thank you, Heidi.
Thank you.
Steve Lamtiaco, PDN.
Yes, hi. So Governor, early on you mentioned that all of these people were involved in allowable activities, but somehow they let their guard down. I think in the case of the basketball game, someone was there who was symptomatic, right? But how did people let their guard down in these other cases? Like, what did they do wrong?
Because of the investigations?
When what you're asking is what is different from other games, or what is different from the individual who was symptomatic and exposed others?
No, the governor said that these were all allowable activities, but that somehow people had let their guard down. The issue is letting your guard down. How did people let their guard down? Were they not wearing masks? Were they, what exactly was happening at these parties that was wrong?
that like the governor mentioned, that when you let your guard down is when you do not follow the guidelines that were given out to individuals, wearing your mask, keeping safe distance, and washing hands. But to your question, when you're playing a game of basketball and you are symptomatic, which one of the individuals during this event was symptomatic, they would have stayed out of the game, because being symptomatic at that point means that there's something going on internally. So it is a personal responsibility of individuals when they feel sick to stay away from others. So this individual did not stay away from others, and that would have been the source of transmission within this group. Thank you.
All right, thank you.
Steve, did you have a second question?
No, that's it.
Thank you. Going around for a second round, Maureen Maritita, any follow-up questions?
Yes, I wanted to ask about the demographics that were touched on earlier. So I think it was said that the people who were in these groups were between 21 and 44 years. So how's that group doing with vaccinations? Are they well vaccinated? I mean, there's an assumption that the over 60s are doing pretty well, but what about the 21 to 44-year-olds?
I'll go ahead and take that question. So one is that so we're still gathering the vaccination status of all those who have been tested overall, but as of those that are positive from all these clusters combined, there are 5 that had at least their first shot, yet still tested positive. So I mentioned earlier that since the beginning of the year, that there's been 21 total that have had their first dose, yet still tested positive, and not yet having their second dose. And so out of that 21, 5 of them came from this cluster overall.
Okay, and then thank you. And then we talked about the numbers of individuals who'd been traveling. And so together about a third of those who had been traveling were comprised of people who were either white, Black or African American, or mixed. So I appreciate all the information, but could you say, are you able to say whether those people are maybe contractors or from the US military, or do you have any information of that sort?
These are not broken down by whether or not they're from Department of Defense or civilian otherwise. So, but you know, people can look at the data and make their own assumptions overall. But you know, I'm sure it's a combination of both civilian and DoD.
Okay, thank you very much.
Thank you, Maureen. Jerry Partito, any follow-up questions?
Yes, this is for the governor. Governor, some tourism officials are saying that reopening Guam this May not really count because our source markets like Japan and Korea are still restricting travel. What do you think of that? Can you comment on that?
That's absolutely true. And we have said in any announcements or messaging that if we do relax or change or modify our travel protocols, we don't expect on May 1st for tourism to come. So you're right, they may not come right away. And in fact, the GVB and the tourist industry is predicting that it probably won't even be of substantial travel to Guam until the second or third quarter of 2022.
Okay, thank you. And this last question is for Director San Agustin. Director, during GVB's board meeting this afternoon, they revived the talks about the possibility of of them subsidizing tests for tourists returning to their own countries, sort of like a come on to, to make Guam an attractive destination. Now, one of the board members suggested that instead of GVB spending money, which they don't have, to procure test kits, they're suggesting that public health has an existing inventory of test kits. They're asking whether they can just avail of that for their planned project to test tourists. Can that be done? Do you have enough? Do you have a surplus inventory of COVID test kits?
To your question, yes, this actually has been raised on several different occasions about collaborating, and that's actually where we're at. We'll need to sit at the table with GVB and be very clear actually in what they are requesting of public health and social services to ensure that the expectation of those that do visit Guam, that we can meet that expectation and that we do in fact have that inventory. Currently we are with test kits, but when we look at tourism past May, really the question is whether we would continue to be able to sustain that service, and we don't definitely want to set a process up today that in the months to come we would have to revisit because perhaps we don't have as many test kits. It really all depends on the support of our federal partners with regards to where we are with the public health emergency. But the idea of using our public health test kits is a viable one. It's one that we can consider, but we will also need to look at the manpower that would be required to stand up these test sites, whether it be down at Tumon or would they be considered to come to the public health site. So it really is a little more than just saying, yes, we could do it. It will require a little more discussion and conversation in terms of how we can make the details.
Okay, thank you.
You're welcome. Thank you.
Thank you, Jerry. Nestor, do you have any follow-up questions?
Yes, Art, the 9 that cases that will likely be announced later today, are those related to these other clusters that you reported on today?
Nestor, at this point, we cannot answer the question because we are still doing our initial interviews. So that would also suffice. And if there's more information, we will share it with the governor and the director, and then we can give it out to the public. But right now, these are new cases, and the first thing we do is, if there's a new case, is to cut off transmission by isolating them. So when they are isolated, then it gives us a chance to interview them. It's a little long process, but we can, when we have available information, we'll make it available to leadership.
Okay, thank you. And Governor, when do you plan to make an announcement regarding your decision on the May 1st reopening?
As we have done in the past, Nestor, will probably make it maybe 3-4 days before it's effective.
Okay, thank you.
Thank you, Ness. Marvick, any follow-up questions?
Okay, just one more question. In Palau, when Palau reopened, officially reopened their borders, they launched the travel bubble with Taiwan. How about for Guam? What will mark the May 1 reopening of Guam tourism? How do we mark this event if we are going to officially open?
So I know that there are discussions being made between Taiwan and also our GVB team. So that is ongoing, Marvick. So we are, of course, more than excited to see whatever kind of bubble program or system that we can develop so that we can encourage visitor arrivals.
Thank you so much. That would be all for me.
Thank you, Marvick. Any follow-up questions, Heidi?
Hi, this question is for the governor. Governor, will you use a portion of the 660 or 630 million from the American Rescue Plan to assist GVB in case they proceed with shouldering the cost of COVID testing for tourists returning to their country of origin?
We are, of course, going to support GVB and support tourism in any way we can. If they feel that that's a program that may be viable in incentivizing and bringing tourists down to Guam, then of course we can discuss that aspect. We would have to see what it would cost, what the budget would be, and if they so desire, they can take it out of the amount that they would be supported.
Governor, are you talking about the 20 million that's supposed to go to GVB from that 600 million plus?
Yes.
Governor, what about the status of the RISE Act payments? Will there be, should people expect that to also come from the 600 million ARP funds?
The RISE Act, as I have said in the past, Heidi, in many, many occasions, is something that I am looking at to make sure that everybody's treated fairly. I don't have the monies right now, but certainly my goal and my agenda would be to treat everybody fairly.
Thank you, Heidi. If there are no more questions, I'd like to give it back to Governor Leon Guerrero for closing remarks.
Thank you very much, Crystal, and thank you for the questions that the media has posed, and hopefully we have addressed a lot of your issues, and hopefully we've addressed your questions, and I encourage the media to be part of our team as you have always been, to make sure that we message out and we encourage our people and persuade our people, and to, again, don't let your guards down, wear your mask, wash your hands, social distance, and as the Lieutenant Governor emphasized, when you're sick, do not come to work. When you're sick, do not go to church. When you're sick, do not go to restaurants. Basically, when you're sick, stay home. Thank you.
Thank you everyone for joining us today. Please be safe. Again, wear your mask, wash your hands, and watch your distance.